is about the posterior pituitary now. This were associated with the anterior pituitary. In anterior pituitary, you can have like just like prolactin secreting, you can have THS secreting adenoma in which hyperthyroidism can be there. Okay. So now let's see hypofunctioning pituitary syndromes. In case of hypopituitary pituitary function syndromes, all the glands basically will have hypofunction. Like either it is thyroid, either it is adrenal gland, either it is your FSH, LSH that is causing the function of the sexual secondary sexual features or the libido of the patient. All this will go down. Okay. Even in patients of Sheehan syndrome, that is causing postpartum necrosis pituitary. Okay, postpartum pituitary necrosis, that can also be one of the cause for the hyperfunctioning pituitary tumors, right? Even in case of mass effects of the pituitary gland also, like as we discussed pituitary adenoma, you can see the functions of the because of the mass effect, definitely there will be compression of the optic chiasma that causes hemianopia, bitemporal hemianopia is typically seen in this patient. Okay. So now let's see about this, that is the posterior pituitary. As you can see, this patient presented with the polyuria, polydipsia. All right. So what this point towards is, typically this points towards this patient. So as you can see, this is the normal bright spot of the pituitary over here, and here there is absence of the bright spots on the pituitary, posterior pituitary typically. So all this points towards the diabetes insipidus. So we have two types of diabetes insipidus: central, where the pituitary is affected, and second is nephrogenic. Even gestational diabetes insipidus is there. Okay, central and nephrogenic. So central is associated with the ADH deficiency. ADH is one more hormone, that is vasopressin. Okay, that is produced by your pituitary. So ADH posterior pituitary, ADH deficiency is there. Basically, it's produced by the hypothalamus, stored in the pituitary. Then nephrogenic is again because of the renal resistance to these functions. Okay, so I will just write renal resistance. Okay, that is typically a nephrogenic diabetes insipidus, right? So these are the findings typically you will see in these patients. Okay, so as you can see, urinary osmolality for this patient will be quite high, and for that we can do vasopressin test. And so what is this vasopressin or water deprivation test? Sorry, not vasopressin test. So basically, water deprivation we ask the patient to do. We check the body weight of the patient, and as you might remember, we can give vasopressin. If with the vasopressin there is no improvement, that means there is nephrogenic, okay, diabetes insipidus. And if the vasopressin basically, if it improves, that means it's associated with the pituitary hyperfunction. Vasopressin, and it is improving, then it can be pituitary hyperfunction basically. That we can do in, and it is usually done in the association of the water deprivation test. What has happened with the water deprivation test is, if on water deprivation the patient's osmolality, urine osmolality gets back to normal, okay, that means it is the psychogenic, it was the psychogenic polydipsia. Okay, this was the psychogenic polydipsia. And if it doesn't get back to normal with water deprivation, that means it is the pituitary disease. Okay, that means it's pituitary disease, basically your diabetes insipidus central. Okay, so that's all about the important thing when we talk about the diabetes insipidus. Now, just like diabetes insipidus, if there is an excess of ADH secretion by the pituitary, that will be called as SIADH, right? So SIADH is syndrome of inappropriate ADH, in which ADH will be produced in lot of amount, excess amount by the pituitary. Okay, it can be either ectopic production, for example, in lung cancer, even CNS disorder like subarachnoid hemorrhage, etc., and even certain medications can cause this. Okay, so even this diabetes insipidus can be drug induced, like lithium kind of drug can also cause this type of diabetes insipidus. Okay, so that is about the diabetes insipidus imaging. Typically you will have this type of absence of the bright spot in these patients. Okay, that is the most important part you should remember, right?